The fact that I was in my 40s was not a deterrent for me getting a facelift. I felt like myself, but better. I also felt like myself, but free. If someone is on the fence about having a facelift and your only concern is whether you're too young or that it's going to accomplish your goals, I absolutely think you should move forward.
Hey, Talia.
Hello, Dr. Kim.
It's been a while.
Yes, it has. I'm happy to be back in your new place, which is absolutely gorgeous.
Thank you so much.
And well-deserved and well-earned, by the way.
Thank you. Thank you. Well, we had done a segment on this before, but I really wanted to do it here at Kai because we just have this amazing setting. And I wanted to talk about a topic that we talked about years ago, but really is still a hot topic, and it's about having a facelift in your 40s.
Yes.
And you had a facelift with me in your 40s.
I did. I did. And I'm highly supportive of that.
And I want to talk about that because, you know, when I look at your before and afters, and of course you'll share what it did for you, I see exactly what, you know, why we did this. And as a surgeon, we kind of have this like ethical like nudging when someone is, you know, attractive and young as you, comes in their 40s, and they say, I want a facelift. My first inclination is, well, there's got to be something else that can do what a facelift can do, even though I know very well as a surgeon that there's nothing that
Correct.
that can do what a facelift will do. But can you kind of share your journey before we decided to do the facelift for you?
Absolutely. I think that, especially as, you know, a patient, your inclination is to try and see what you can do before you go under the knife. There's a preconceived notion of, oh, that's for older women, or that's for when you have like real extreme laxity in your skin, and oh, I don't want to look like I've had a facelift because it's too soon. So all of those things come into play. And so, I mean, I chased a number of things. And these are also per recommendations of some doctors, but also you just kind of research yourself. And regardless, you start doing everything. I mean...
Okay, rattle off everything that you did before we did a facelift.
Okay, so before I did filler, which that was a real big regret. But I think everyone now knows that, you know, fillers, there's been a lot more information, and that, you know, under the eyes is a big no-no. So I did filler. I did PDO threads. I did silhouette threads, which was the worst ever. I actually did silhouette threads and had to come to you from Florida because it was sticking out of my face. I was horrified. And, you know, and you were so wonderful with that. Like, immediately, you're like, don't ever do anything experimental. Don't ever do anything unless you talk to me. And having, you know, a confidant and someone who's, you know, a surgeon with your expertise that tells you and advises that has been such a gift. But
what about energy devices? Did you ever do like all therapy?
Oh, I did all therapy. Okay. Oh my God, that's right. Let me think now. It's been so much. I did, let's start over. I did filler, PDO threads. I did silhouette threads. I did Botox, obviously. I did all therapy. I did Profound. I think it was called the deeper one, which was the most painful thing I've ever experienced in my life.
That's torture.
I did Morpheus. I did Genesis, Pico.
So just so that people don't think that you're some body dysmorphic.
that did come off that way. This is over years, people.
What were you trying to achieve? Like, what were you looking for?
So for me personally, it was a slight laxity that I saw in my lower face specifically, that you couldn't really feel. It was a little drooping of my mouth here, which was why the PDOs were put here and they were lifted there. And so I saw it happen, and I will disclose, like, a lot of times it was more so when I'm either looking down or if I see myself like on a certain angle. But the laxity was there, and it can be somewhat fooling to you that if people see you, oh, well, you know, you're pretty and I don't see it. What are you talking about?
Well, that's so interesting you say that because I turned you down a couple times.
Yes. It took me 3 years to get you.
Yeah, because I was looking at you were so young, and I just thought I thought you looked good, but I didn't really sit down and listen to you in terms of like, what are the things that, I kind of did what a lot of surgeons do, was just go on my own opinion and what I think should be right for your face. And it wasn't until you kind of hit the end of the road in terms of, and then we had to do all the reversal of the fillers,
Yes.
Under your eyes,
Yes.
and this and that before we
And
went
cheeks,
in.
yes.
Luckily, with the threads, we knew that waiting a year wasn't going to complicate your surgery. And the crazy thing is that, and I want to talk about this, is that despite all of those things that you had a perfectly executed surgery. I didn't run into any issues or problems, because I know you were really worried about that.
I was concerned, yes.
Because a lot of surgeons are saying, oh my gosh, threads are going to ruin your facelift.
Correct.
You're going to have complications. Did you ever do biostims? Did you ever do?
I didn't.
No,
I
you
didn't
never
do.
did biostims,
No.
yeah. You just did like PRF gel and all that.
I
kind
did
of stuff.
PRF gel, yeah, exactly.
So, but then one day, I remember actually the day, one day you were like, I think I'm ready for a facelift. And this was like the third or fourth time. And then I looked and I knew what you had all done. And then when you showed me, I said, oh my gosh, you are. And also what dawned on me, because I've been doing facelifts on a more mature population, is that when I had occasionally done facelifts on my patients in their 40s, they did amazingly well. They healed fast. And because of the natural amount of collagen and elastin in the skin, it's lasted a lot longer for them than my patients that were like perimenopausal, postmenopausal, especially on my patients that were not on HRT. And now that is such a huge hot topic. And I can't even believe it now that I ask every single one of my female patients about HRT.
It's absolutely true. That's something that's in my wheelhouse, and I 100% agree with you. It's a game changer.
Yeah.
Making sure that you have sort of yourself healthy and in check with your hormones and your supplementation so that your healing process is optimal, and that when you are choosing to do something like this, you're going to have the best outcome and the best results for the longest time possible, for sure.
So let's talk about you. So we did your facelift. It's been about 2.5 years now.
Yes.
What has it done for you?
It's taken the monkey off my back. It's just been very freeing. I think being from the fitness world, I would always tell a lot of my clients what's most liberating about getting in shape and being an optimal weight is that you no longer are looking over your shoulder or feeling self-conscious about how you look or how you seem to people. That's off the table. So it gives you more freedom to focus on your career, your family, or any endeavors you have, because you're not as self-conscious and obsessed with, what you think you're lacking because of your appearance.
So it's giving you confidence.
Oh, it's given me complete confidence. Freedom, obviously, with makeup, less time. And then also the less expense of having to look for fillers, look for lasers. I mean, the amount of money that I've spent on trying to prolong and put off the facelift probably was more than the actual facelift itself.
It probably was.
Yes.
Just with that list
don't even want to
that you gave, it probably was. I
Yeah.
mean, and facelifts, depending on who you go to and expertise, like the average, I'm not talking about these outliers. It's usually between $50,000 to $100,000.
Correct.
I mean, that's about the going rate for a deep plane facelift. Of course, you start adding all the extra bells and whistles with fat and nano-fat eyelids and lasers, and it can become more.
But it's the best investment I think a woman can make for herself.
Yeah.
I mean, and that's what it is. And it gives you the confidence and also the aesthetic for the world to take you. Because let's be honest, it's a world that judges you based on your appearance, especially for women. Right. And so to have that be something that you no longer have to be concerned with, it was very freeing, and it gave me a lot of confidence.
Yeah. So I turned you down for about a few years. Why did you stick with me? Why did you choose me as your surgeon?
Well, one, because every time I made a mistake, I came to you.
Bailed you out.
And you saved me. But I think also everything you sort of forecasted and everything you suggested was always spot on. And that was very comforting. There was a built trust of, trial and errors of my own doing that always came back to where that's what Dr. Karimi said. That's what he had sort of encouraged. And you're I'll be honest, the bedside manner is very nice too. I mean, there's a lot of surgeons who aren't as personable. That's not always a requirement for a lot of clients.
Right.
But the fact that I had your expertise, your knowledge, your insight, and then one of the most compelling things to me was your experience with just aesthetics. Not too many surgeons know the face in regards to all of the accoutrements with the Botox. And I mean, you being a master trainer and teaching, that's like a 2-for-1. I'm having someone who understands the aesthetic of the face, what it takes to the maintenance of it, along with the full deep plane knowledge that a surgeon would have. I mean, that was...
Well, I love that you say that, because some surgeons say, oh, well, if a surgeon's not just operating, then you shouldn't go to him or her. And I feel the opposite. Of course, I'm biased, because I feel that those of us that do injectables, and I do cadaver dissections and teaching, so I see parts of the face that a surgeon would never see.
You do.
And I go to places with my needle or a cannula that surgeons will never go to. And so I think that has really empowered me to be able to kind of offer the full package.
Oh yeah, it's an extra bonus by having someone with that technique, that experience that you have doing the most important thing, which is your face.
Yeah. Now, you were talking a big game leading up to the surgery, and then surgery week came, and you were like scared.
I was.
So talk to me about that, and then talk to me also about kind of your experience with my team, the anesthesia, the whole process, and that final moment when you're like walking with your gown
Oh my gosh.
into the operating room.
I was really excited, but yes, that final week, suddenly I was like, oh my gosh, what am I doing? I trust this person, but what if I don't look the way I think I'm going to look?
Yeah.
I know we have the same vision for the outcome. And again, I think sometimes with surgeries that aren't that extreme, being that I was younger and there wasn't a lot of laxicity we were addressing, it's a subtle correction. With that can be overcorrected, and you start getting nervous and having these horror stories in your head. But the one reassuring thing was you and your team. Speaking with them, hearing about the other surgeries that you've done with other clients, everything was just so calming. And I felt really safe, and that, okay, this is the right place for me to be.
Yeah.
And I was ready.
Yeah, now you're talking about minimal laxity, and so a lot of folks are going to wonder, why did you have a deep plane? Deep plane sounds very invasive versus a mini lift. I mean, you know the answer, but in your words, why did that make sense to you? And then I'll kind of explain why we did that.
So I think there was a time where people, the word mini facelift was something that was very prominent, and that seemed the go-to. But the reality, if you really do your research, you understand what it takes to reconstruct a face. It's definitely about going into the muscle and a deep plane facelift that addresses the muscles, the ligaments, and the tissue. Because what you're doing is you're lifting and attaching all those things together, so you still have the same face and it's holding in the proper position. Whereas if you do a mini lift and it's just addressing the superficial layer, then that's when it has the risk of looking more pulled or it not lasting as long, because your face starts to drop or your muscles change or you age. So it really is almost like, no different than PDO threads in a way.
Yeah. So I was trained on deep plane, 16 years ago. And when I came into practice, everybody was talking about mini facelifts, mini this, mini that, and everybody had their own name for it. And I'm here and I'm like, why am I doing deep plane facelifts? Because deep plane facelifts are, I would say, the riskiest type of facelift. They take the most expertise because you are on top of the muscles that move your smile. You're right by the facial nerve. There's issues. But what I really liked about them was that there was a lot less dissection of skin. And that was mainly done deep, under that tough layer, the SMAS layer. But what I also have learned, because I fell into that same trap. I was starting to do like a little mini neck lift thing, which for the right patient was great.
Right.
But it would not lift the cheeks. And to lift the cheeks, the only thing that really works and stays is a deep plane facelift. That's by
I agree
by
far.
definition.
It's non-negotiable.
So if you just need this, sure, you could do like a little mini neck thing. But if you want what most people want, which is an actual youthful reset of the face, and then with or without the brow, then that is what is called it.
Absolutely, and that was my main issue is the laxity here, and it also addresses your nasolabial fold. So having that addressed, especially because it was so minor. by being able to do a deep plane is where it will pull and then reattach itself in a really natural way.
Well, patients are actually asking for it without knowing it, because nobody comes and says, I want this.
That's good.
Okay?
That's
They
good.
all do this.
Yes.
Everyone does this. And sometimes it's 2 fingers, 3 or 4 if it's really bad
Yeah,
shape.
the
The 4-finger salute. But that's the reset, because when they do this in the mirror, they see their more youthful selves. And so that is exactly the direction that it goes. Now in the neck, we are able to pull it back, but we kind of split the muscle. It's a little bit technical, but so it's a bivector approach to do it. This goes up and back. And so that's really,
which is like an optimal look.
way.
Yeah,
That's the
absolutely.
optimal look.
Well, what interesting, I don't know if you remember, but what was really interesting after I got out of surgery, I remember you saying something really distinct to me, which I knew, which is why I kept asking year after year. But I finally reached the final point where you approved, and I'm very comfortable with that decision. But the amount of skin that you actually removed.
I wasn't going to say it because I didn't want people
No,
to think,
you can say it.
Yeah, you had 2 inches.
Yes.
Yeah.
Yeah,
Totally
and so again, I sort of prompt people who are in their 40s, or when you are younger and you are thinking of doing a facelift, people's skin is differently, and the way you carry it, the length of your neck, your bone structure, and so what you sort of lies there and rests on you can be deceiving. And so it takes an expert like you to give you the green light when you're ready, look at the elasticity and say, okay, there's enough there. But even then, it surprised you that I had more than...
It did.
Yeah.
It really did. Now let's talk a little bit about the scars, because one of the big kind of barriers for people to move forward with this is they're worried about the scars, particularly my patients with skin of color, like you. So talk to me about kind of your scar evolution. How are you now with the scars? Do you have to wear makeup and cover up? Are you able to wear your hair back? Like, be honest. Like, how are your scars?
I was really nervous about the scars because I do keloid. The scars, it's kind of twofold. For me, the scars on the face, which we mutually spoke about where to do the incision. And we made the best decision ever. Because there's 2, which I'm sure you can explain to your patients, there's 2 areas where you can make the incision to reattach. And so we did it along the shadow of my ear, because I have the way my ear folds. And it absolutely is like seamless. I mean, it's a really wonderful line. You can't see it. I don't put makeup on it. Other than that, my scars behind my ear, I did keloid a little bit on that. So that takes a little bit more work. But you should expect, that was the one thing I do want to sort of implore to people. When you get a deep plane facelift and you're investing in it, it's just like when you invest in your home. You're going to like replace the roof. You're going to maintain the gutters. You're going to like maintain the lawn. And so you do need to upkeep that. And so for the scars, these in particular, it was a little bit more treatments that I needed to do.
Some injections.
A couple injections, a PRP, and so just so they gradually go down. But I mean, it hasn't kept me from wearing a ponytail. I train all the time, so my hair is usually up in a ponytail. So it's been a much better experience than I was worried about. So there's no darkening, and it's been really great.
That's awesome.
I was so pleasantly surprised.
I knew you were really worried about it.
I was.
And with good reason, because with skin of color, there's a higher chance of what's called a hypertrophic scar, where the scar is a little thicker, hyperpigmentation, where it's a little bit more brown. But those are all completely treatable, either with lightening creams, injections of steroid, or sometimes some light lasers, and they usually all go away.
Which is great. That it should not deter people, because all of these things can be addressed over time. And so, it's been wonderful. Yeah.
So let's kind of summarize all this. What would you tell someone in their 40s considering a facelift, but all their friends and their family are saying, don't do it, you're too young?
Well, the first thing I would do is tell them to absolutely do their own research and make their decisions with professionals who they deem qualified to give them advice on that first. And I'd also say, take a look at what you're investing in trying to chase and prevent whatever issue you have going on with your face. Looking back, I 100% would have rather spent that money on going forward with the deep plane facelift, as opposed to going through the lasers, the fillers, and the different modalities to try and fake the appearance that my face was not having laxity at that point. What's really great about it too is I think doing it earlier, the healing process is easier on you. You're in a healthier state of mind. you also are able to handle the recovery process better. I just feel that most women, if you really are thinking and considering it, you absolutely should talk to your practitioner, have them take a look, assess you, and then make your decision then.
Yeah, I think it's a great point. And now I've been far more receptive to listening to my patients exactly what their real issue is, because it's not so much about the age; it's about anatomically what's happening. And I now know not to steer someone to energy-based devices, threads, fillers, biostimulators. While I do all those things in the right patients, but for the patient that's really telling me I want and need a facelift, then we consider it. And there's a stigma.
Thanks to me.
Yeah, thanks to you. Yeah, you really helped me break some barriers there, because again, our old school thinking. Now it's so interesting because men and women get rhinoplasty as teenagers. Women get breast augmentation or body surgery in their 20s.
Yes.
And so there's something about a facelift that it's just like when Botox first came out. Botox was for old people. And now, there was a huge stigma
That's so interesting.
against Botox. Now, fast forward 20, 30 years, we're getting preventative Botox, baby Botox, or whatever you want to call it. And while I don't know about a preventative facelift,
Right.
there is something to be said about being able to lift the cheeks, achieve tightening along the jaw neckline. Some patients have heaviness of their lower faces. That's all deep plane, and that's all our increased understanding of anatomy from world experts, from cadavers, from just collective knowledge. And I think we're in a real golden era of facelifts.
I absolutely agree with you, Mark. So I remember it was really bothering me. I was noticing my face more and more, a little laxicity. There was an issue in sort of my lower corners of my mouth, and they just began to seem a little heavier, or that there was a little extra fold. So I would try, okay, maybe I need filler, and maybe I need this, and it was just chasing it and never really solving the issue. There'd be a temporary fix that just really wasn't a fix. And so I remember I would be looking down, or I'd be working on something, and I would just see the laxity of my cheeks, the weight would just hang here. And that was just, it was bothering me so badly. I felt super self-conscious. I didn't feel as ease when I would talk to people or when I would meet with people. And so I looked for all these alternatives, trying to remedy it and make myself feel better. But I knew ultimately that what I wanted and needed probably was a facelift. One huge component was I am very active, and I'm actually, I have a long history of being in fitness model. I was a professional. And one thing about that is when you train, you lose a lot of body fat. And so I remember the years prior to my facelift already seeing there be a sort of a loss of fat in my face, which the fullness wasn't there as much. And so there was definitely a clear laxity that took a toll from those years of training and being lean for this long. And that was probably the beginning that I noticed it. And that was a component I know that was not going to be filled in or altered unless somehow I did have surgery. Unlike most people, the fact that I was in my 40s was not a deterrent for me getting a facelift. I absolutely think that when you are in your 40s, that is a prime age when you should start looking at the structure of your face, what's happening. It's a lot of genetic factors and component, lifestyle component, but absolutely I think it's the best time. You're at beginning of midlife when you're in your 40s. And so you have half to go. So my philosophy always was, and my mindset was that, okay, I want to be optimal. This is I'm just in the middle. So I want to do everything I can to be my optimal physique, my optimal look, my optimal mindset. And so in your 40s, it's the perfect time to do that. So that way you're still running hard halfway there. So the actual day of my facelift, I was very, very nervous. I I was nervous because you start to think of, okay, what if my expectations are too high? Or what if it doesn't meet my expectations? Or what if I look different and not just like a more youthful, vibrant version of myself? But I will say this, I was very confident going in because of Dr. Karimi. And also there's so many modalities now that really assist with your recovery. Being from a fitness background and nutrition background, I knew there was like a certain diet I had partaken for pre and post operative results that were optimal. I knew that with the technologies like hyperbaric chamber and red light therapy, I was ready and prepared for that surgery. So I will say that that offered me a lot of comfort going in, knowing that I had that waiting for me to heal as well as I could. After my surgery, surprisingly, I don't remember any pain. I don't think I even took pain medication, quite honestly. There was an antibiotic they recommend, but that's pretty standard, just so you want to prevent infection. I think the most surprising thing was just having to sit upright for a week, but you definitely are, you want to do that, so it's not like they have to convince you or it's something putting you out, because all you keep thinking is you want it to stay there. Like psychologically, you know something was altered and you don't want it to be ruined. So, but in the first few days, it wasn't very much pain. I think I walked out. A friend of mine drove me home. It was seamless in that capacity. I did not have a lot of bruising. I know each patient's different, but I did not experience a lot of bruising. My face was swollen, but by day 7, I looked somewhat like myself. So that was actually really surprising. It isn't this sort of deconstruction, like tearing your face apart that people may have this vision of. It's actually a really beautiful, sculpted experience where when you're working with a surgeon who does a deep plane, because they've definitely taken the care to like take everything and put it in the proper place. So the recovery was beautiful. The first process, when you start to see, you start to heal, and you're like, oh wow, I'm looking like myself. You're almost shocked. You're like, wow, this worked. You get excited because you're like, okay, it's not the fear part anymore. You're like, oh my God, this really worked. I can't wait to see it fully healed. You get really excited. And a close friend of mine was with me, and he was just fabulous support through that, because the whole time, play by play, he's like, oh my God, you look so young. Oh my God, you look so young. And that is like, that's always nice to have too. But I mean, he's pretty honest. He's loves aesthetics and things as well. But it's just, that was really exciting. And so then when I got to the point where I went to the office and they were able to take out my stitches, I mean, it was just amazing. I felt like myself, but better. I also felt like myself, but free. I don't know how to quite explain that, because people don't realize when you constantly are thinking about something, whatever it is that's bothering you, it really distracts you from being able to focus on so many other things. It's always in the back of your mind, not like an obsession, but just almost you just feel like you're not quite as confident. And so I didn't have that anymore. So it was just really liberating and freeing to have this new version of myself that was tighter, seemed tighter to me and lifted to me, and it was just me. And the really great part was no one even knew I had a facelift. I mean, no one I knew. My people close to me, I don't think most of them still know, but they will now. Some of the best compliments I received after my facelift, which I loved doing, was I would go get a facial, or I'd have a lot of doctor's appointments. So like whether it's my GP, my general practitioner, or my OBGYN, and all of them would see my age, and they would all be like, oh my God, you look so young. They would all comment on like, what are you doing? Like, what's going on? How do you look so young? And that was a great testament to that. Oh wow, I still look like myself. I still, no one even knows I had work done. And that was pretty reassuring and fun. If someone is on the fence about having a facelift, and your only concern is whether you're too young or that it's going to accomplish your goals, I absolutely think you should move forward. it's really an answer to problems that you can only address through a deep plane facelift. A lot of times I think that everyone tries to look for the shortcuts. If you do have the money that you can spend, it's absolutely better to go ahead and get the deep plane. I would say sooner than later. I mean, it's definitely the prime golden time of deep plane facelifts and people promoting it everywhere. But you definitely want to have a practitioner who has a lot of experience, board certified in that surgery, where he learned the technique to address all of the things that are required for a deep plane facelift. That's absolutely number one most important thing. But if you think you found a provider you trust, you've done your homework, go for it. The one thing I have to say about this experience with Dr. Keon, it was just an added bonus to something that was life-altering, that was a major decision. And not only did you have the expertise of someone who knows aesthetics, but also you have someone who specializes in plastic surgery. Having that along with the third trifecta, which is his amazing personality and bedside manner and regard for care, it just made this seamless experience that I couldn't have dreamed of. And I would highly recommend that to anyone who's thinking of this. You're in safe hands. And I felt so treasured and safe in his hands. And even now, I'm just gleaming with the results. So I'm very grateful.